My mom is in her 80s, very sharp and responsible for her own care. She has had various experiences with physicians who did not welcome her questions about whether she really needed certain medications or tests. They were rather dismissive. Do you have any advice for patients about how to start these conversations constructively?
Great question.
I'm happy to take it since it's something that I do every day. I think, first of all, we need to figure out what are we treating, what are the goals of treatment, what are the goals of a relief of a symptom or treatment of, sometimes we treat conditions that you don't feel that you have and you're asymptomatic. So what are the goals? Are you looking to have to be free of pain? Are you looking to go back to your previous level of activity? So again, it's part of the conversations of we mentioned before about the goals of care, the goals of your quality of life, what you're hoping to get out of day to day. I think you know, this is up to the patient to some extent to come to the physicians and say, I have these questions. What is this medication? What is this condition that I'm having? What are the options of treatment? What are the pluses and minuses? What are the benefits and harms of this treatment? Let's have this conversation. And this kind of conversation should happen in every single exam room with every single physician of every single specialty. It's not just family physicians, it's not just surgeons, radiologists, a little bit different. ICU, I mean, but these are questions that are legit, and I think oftentimes what we see is patients are afraid to ask their doctors, to seem to be challenging their physicians, but I always say, ask these questions. If you don't feel that you can ask yourself, bring a son or a daughter or a spouse or another person who can speak on your behalf and ask these questions.